Hello, I'm Dr. Whitney Bischoff, and I'm here at Guadalupe Regional Medical Center Wellness Center, where I usually do yoga, and it's so awesome. But today I'm going to talk to you about these cloth masks that are going to be distributed to the staff here at GRMC so that we can help everybody be a little bit healthier. I'm Dr. Whitney Bischoff. I've been a registered nurse for 40 years, and I recently retired to take up my passion for quilting. And instead, I find myself spearheading a team of 12 individual sewists who are helping us make these masks to keep you safe. I want to talk to you a little bit about the mask and how to take care of it and wear it properly, and then also how to take it off properly. This is random fabric that we've all had in our, what we call our stash. So there's no meaning to the fabric. We just took what we had. It had to be 100% cotton. We've put a little bit of a twist tie inside, and then we've made a pocket on the inside so that you can put one of these pads, and I'll talk about these in a minute, if you need a little bit of extra filtration. But the way that you do it, and they tell me that if you wear glasses, that this is the way to do it, is that you want to mold the twist tie to your face like this. Some of them may be pipe cleaners. And then put your glasses on like this, and then push down on your glasses. And what this is gonna do is it's gonna keep the air from coming up and fogging your glasses, which is gonna drive you crazy. The other thing is that it's gonna keep you from touching your face, because we know that touching your face is really a problem when there are germs just around, and it's so easy to introduce them into your body through one of your mucous membranes, which is your nose, your mouth, your eyes. You just really don't want to contaminate yourself or bring germs home with you. So one of the things that we can do is that we can wash this carefully in hot water. They're going to stand up to it, and when they no longer stand up to the hot water, then throw them away. But hot water, hot drying. And then if you're going to use one of these pads, this is what we recommend. We want you to wash your hands or sanitize your hands first, because these are individually wrapped. These are nursing pads for women who are breastfeeding, and you can get them in the grocery store or the pharmacy. They have little tabs on the back that you can adhere them. If you wanted to, you could just adhere them like this, but that's not what we recommend. We made this, the pouch in the back, the pocket, so that you could put this in here and have a little bit of extra protection from more layers. So this nursing pad right here, like that. So now you can see that it's completely enclosed. It's right here. This is recommended if you have a cough or a cold or something that you're getting over and you're safe to return to work, but you just want to be a little bit more careful with your own germs. And then you would again put it on like this and loop it over the ears, and you can work all day like that. Now you want to be sure that you have pulled the pleats apart so that you have air in there, otherwise you're going to feel claustrophobic. Some people are telling me that the loops bother their ears or they're not big enough, and what you can do is take a ribbon like this and put it around your loops and then tie it like this in order to take the stress off the ears, okay? Now when you take it off at the end of your shift, this is the contaminated part, because this is other people's germs and the part inside is your germs. So you want to grab both loops like this. You want to fold it inwards, more like that, okay? And then you want to put it in a plastic bag and seal it up so that you can take it home, take the pad out. Don't reuse the pad. Take it home, take the pad out, and wash it in hot water, okay? You don't want it to sit around. You don't want anybody else to touch it, but that's what you want to do. But since I've got you here, I'd like to talk about a couple of other things that are important while we're trying to keep everyone safe. The first thing is you don't want to wear anything below your elbows, because rings, jewelry, watches are just a way to get contamination and spread germs. So if you have this kind of watch band where it's something that you can wash off and it's not cloth and it's not gonna, or metal, and it's not gonna catch germs, you can do that. You do want to wash off your cell phone as well, because that's something that gets very dirty and a lot of people touch it. And you want to use your hand sanitizer as much as possible when you don't have soap and water. But the other thing that's important is it's not just the washing, it's the friction. And so when you're finished and you've got your towel, you want to really, really dry off and use your towel and the friction to get all the germs off. And then when you go to nursing school, one of the first things you learn is the taps on the faucets are dirty, right? So you turn them on with your dirty hands, you wash under the running water with your soap, right? You sing happy birthday twice, and then you grab the towel and dry off while the water's still running, and then you turn off the taps, because the towels keep your clean hands off the dirty taps, right? And then if you're really gonna be very careful, you take that towel and you go over to the door and you open the door to get out of the restroom or the room that you're in. Okay, so I hope that we can all stay safe and keep the germs to ourselves and keep our patients safe, so that we're just here to take care of the very, very sickest people who need us.